Good afternoon, good evening, good morning. This is Dr. Garais, BIO112, and we're going to discuss briefly Chapter 8. Sorry, as I expected, the recording that I made yesterday on the 13th of March 2023 for our official class didn't take. So we're going to do a quick review video regarding Chapter 8, joints. Give me a second. Lectures, Chapter 8. Here we go. So if you look at this, of course, joints, also known as articulations, these are nice to know, but let's get to the crux of the matter. This is a big slide right here. Notice that the structural and functional classifications overlap. So fibrous and synarthrotic, they belong to the same category. Cartilaginous and amphiarthrotic, they belong to the same category. And synovial and diarthrotic belong to the same category. The first example is fibrous. It's dense connective tissue, meaning that it will hold like super glue. And it's also, fibrous are also synarthrotic. They should not move, because if something has a lot of dense fibrous connective tissue, it's not going to move very much. Cartilaginous, of course, cartilage, they're going to move a little bit. Not a lot, but a little bit. Synovial, very complex structure with the synovial fluid. Those are diarthrotic joints, and they are freely movable. Here are some examples of fibrous joints: syndesmosis, suture, and gymphosis. Syndesmosis, the example of a syndesmosis is the interosseous membrane in between bones. And this interosseous membrane is, of course, is a ligament. And we have one in between our tibia and our fibula, and our radius and our ulna. The second one is a suture, which is, when your soft spots, when you're an infant, start growing out and growing together, they grow into these joints right here called sutures, because they look like, and it's your skull, shouldn't move at all. And the very last example is gymphosis. Again, synarthrotic, not movable, like the root of your teeth in your maxilla or mandible. Remember, your maxilla is the upper part of a mandible, is your lower jaw. Your maxilla is your upper part of, of your teeth, or your upper row teeth. Cartilaginous joints, like your pubic symphysis, synchondrosis, right? Hyaline cartilage, most common. And where can we find them? Epiphyseal plates, the spaces in between your manubrium sterni and your first rib. But symphysis, there's a fibrocartilage, and here are some example of some more cartilage. If you see the costal cartilage here, which is part of your rib cage or your thoracic cage, your pubic symphysis, which is a fibrocartilage here, and of course your intervertebral disc, which is in between these thoracic vertebrae. I know these are thoracic vertebrae because you see this thing, it's called a pedicle. It's going to be connected to a rib. Now, synovial joints, those are diarthrotic. They all move super freely. They are very complex because if you move something a lot, we learned in muscles that it'll tend to get hurt. And the knee is your classic synovial joint. And of course, they have an outer fibrous layer, that makes sense, protection, ligaments, which connect bone to bone, and then the inner layer, which has synovial fluid. And here's the classic. You see a bone here, long bone there. On the epiphysis, there is articular cartilage, and here is a pocket called your bursa, and the bursa houses your synovial fluid. And you see it's quite complex. This is, of course, your patella, femur, and this is the tibia. You don't really need to know ball and socket joints, condylant joints. Just know that these are all synovial joints because they move freely. Your wrist, your elbow, all those move freely. And that's a synovial joint. No definition of origin and insertion. Origin, relatively fixed end. Insertion, the more movable end of the skeletal muscle. It is the insertion that we are concerned about regarding excessive or pathologic movement. Know these terms. Here are these terms in picture form. Abduction, moving your leg away from midline. Adduction, or adding to midline, moving your leg back to midline. You have lateral flexion here, flexion and extension, and notice that the flexion and extension are kind of backwards for your leg versus your brachium or your arm. So flexion means you're going to decrease the angle. And when you move your leg inward like this, you're decreasing the angle here. But when you flex, you're decreasing the angle at this level. Plantar flexion, you're pointing your feet towards the floor, towards the plant. Dorsiflexion, the exact opposite. This is the dorsum of your foot, and that's flexion in this direction. Circumduction is easy, your arm going round and round, or your knee going round and round. Lateral rotation is rotating his arm outward. Medial is rotating his arm towards midline. Supination versus pronation. The best way to learn it is pronation means putting my palms down on the desk. Supination is the exact opposite. Inversion, moving, now you mess up your ankle a little bit, moving your toes inward. Eversion, outward. Protraction, outward. Retraction, backward. Elevation, straightforward. Depression, straightforward. And that's it. That's all you need to know. And that's it for chapter 8.